Level 1, no insurance. You are sitting in the ER waiting room at 11:47 p.m. on a Tuesday. The chair is plastic. Your ankle is the size of a softball. You stepped wrong on a curb 4 hours ago. You waited 4 hours to come in because you did the math in your car. You don't have insurance. You don't have a card to hand the woman behind the glass. You have $312 in your checking account and a credit card you don't want to think about. She asks for your insurance. You say you don't have it. Her face doesn't change, but the keyboard slows down. She asks if you can pay today. You say you can put down 100. She slides a clipboard through the slot. You sign it without reading. They call you at 2:14 a.m. The doctor walks in at 2:38. He looks at the chart before he looks at you. He presses the ankle. He says probably a sprain. He orders an x-ray. The whole visit takes 7 hours from the time you walked in. The bill arrives 6 weeks later. $3,140. Itemized, the brace cost $89. The x-ray cost $1,200. The doctor's name appears on the bill for $640 for the 4 minutes he was in the room. You sit at the kitchen table at 11 p.m. with the envelope in your hand. The system didn't refuse you. The system saw you. The system priced you. The doctor went home at midnight. Level 2, Medicaid. You have a card now. It took 11 weeks to get it. 2 visits to the office downtown. 3 phone calls that went to voicemail. 1 letter that asked for documents you'd already sent. You walk into the community clinic on a Thursday afternoon. The waiting room has 40 chairs. 38 are full. A child is crying 2 seats over. The woman next to him is exhausted in a way you recognize. You sign in. The wait is 2 hours and 40 minutes. The nurse calls your name. She walks fast. She doesn't look back. She takes your blood pressure in the hallway because the rooms are full. The doctor enters 14 minutes after you sit on the table. She has a stack of charts. She apologizes once. She asks why you're here. You tell her. She types. She doesn't look up. The appointment takes 9 minutes. She prescribes the cheaper version of the medication you actually need. She writes a referral to a specialist who books 4 months out. She tells you to follow up. You leave at 6:12 p.m. The sun is going down. The parking lot is full of people who waited just like you. Nobody is angry. Anger costs energy. Everyone here is conserving. The clinic didn't ignore you. The clinic saw 84 patients today. The system isn't broken at Medicaid. The system is doing what it was funded to do. Process volume. You are the volume. Level 3, $50,000 a year. You have insurance through your employer now. $187 comes out of your paycheck every 2 weeks. You don't think about it until you need it. You wake up on a Saturday with a fever you can't shake. You go to the urgent care on the corner. The receptionist takes your card. She types for 3 minutes. The copay is $50. You sit in a clean waiting room with magazines that came out this year. The wait is 35 minutes. The nurse calls you back. She takes your vitals in a room with a door that closes. She asks the right questions. The doctor enters at minute 8. He shakes your hand. He looks at the chart. He looks at you. The appointment is 14 minutes. He listens. He prescribes the brand name. He says to come back if it gets worse. You leave by 11:30 a.m. The pharmacy charges $12 with insurance. You take the first dose in the car. The system worked the way the commercials said it would. You feel grateful in a way you don't say out loud. You don't realize yet that gratitude at this level is a tell. People who don't worry about being seen don't feel grateful when they are seen. They expect it. You are not expected yet. You are accommodated. Level 4, $100,000. You have a doctor now, not a clinic. A doctor. His name is Dr. Klein. You picked him from a list 2 years ago because someone at work said he was good. He was. You see him once a year. The visits are scheduled 3 weeks out. The waiting room has 6 chairs. There's always coffee. The receptionist knows your name when you walk in. She doesn't say it like she's reading it. She says it like she remembered. You wait 12 minutes. Doctor? Klein walks in. He shakes your hand. He sits down. He doesn't open the laptop right away. He asks how work is going. He remembers you switched jobs last spring. The appointment takes 30 minutes. He listens. He orders the blood work you should have done last year and didn't. He says let's keep an eye on the cholesterol. Not the cholesterol is bad. We'll watch it together. The labs come back in 48 hours. He calls you himself. Not a nurse. Not a portal message. A phone call from his actual number. He explains the numbers in plain English. He says one is slightly high. He says it isn't urgent. He says we'll check it again in 6 months. You hang up and realize something. The doctor said we. You have a partner now. The bank started competing for you at $15,000. The doctor starts collaborating with you at $100,000. You are not a patient at this level. You are a project. A small one, but a project. Level 5, 250,000. The post still works. You also start hearing about something else. A friend at a dinner mentions her doctor charges $3,000 a year as a retainer. You laugh. She doesn't. She says she has his cell phone number. She texted him on a Sunday last month and he answered in 4 minutes. You think about it for a week. You sign up. The office is on the top floor of a building you've driven past 100 times. There's no receptionist behind glass. There's a woman at a desk who stands up when you walk in. She offers you water in a real glass. The chairs are leather. There are no other patients. You wait 4 minutes. The doctor walks out to get you himself. Dr. Mears. He introduces himself with both hands. The appointment takes 75 minutes. He asks about your sleep, your stress, your parents' health history, the last time you felt rested. He doesn't type. A nurse takes notes from across the room. He orders blood work that wasn't on any standard panel. Inflammation markers. Hormone levels. Things your doctor never mentioned because they aren't covered. The results come back in a 14-page PDF. He calls you the morning they arrive. He talks for 40 minutes. You realize something on the drive home. At $50,000, a doctor gave you 9 minutes. At $250,000, a doctor gave you a quarterly review. Same training. Same medical school. Same human body in the chair. What changed wasn't the medicine. It was the time. And time is the only thing money has ever bought. Level 6. $1 million. Doctor, Mears doesn't see you in his office anymore unless you ask. He comes to your house. You didn't request it. He suggested it. He said it's easier to see how someone is actually living. He shows up on a Saturday morning in a quiet sedan. He carries a small leather bag. He sits at your kitchen table. He drinks the coffee you offered. He listens to your heart in the chair you read in every night. The appointment is 2 hours. He asks about your relationships. He asks what you're actually worried about. You tell him things you've never told a doctor. He doesn't write them down. He just listens. Then he names 2 specialists. Not refer you. Names. He says I'll call them this afternoon. By Monday morning, both have called you. Appointments scheduled within the week. The cardiologist works out of a private practice you couldn't find online because there is no website. You start to understand something. At $50,000, healthcare is a transaction. At $1 million, healthcare is a network. Doctors talk to each other about you. They share notes the way colleagues share notes about a project. You stop being a name on a chart. You become a case. And a case has owners. People who lose sleep when something looks wrong. 3 doctors are awake at midnight reading your blood work because something caught one of their attention. Nobody told you that was happening. The system doesn't change at $1 million. The system bends. The bend isn't loud. It's just the absence of the things you used to fight. Level 7, $10 million. You don't have a doctor anymore. You have a team. They are organized by an office in a city you don't live in. The director's name is Marcus. He calls you once a quarter. Not to schedule appointments, to check in. The annual retainer is more than most people make in a year. You pay it without flinching. Marcus assembles a panel, a primary, a cardiologist, an endocrinologist, a sleep specialist, a longevity researcher who's published 3 books. They meet 4 times a year. They meet about you. They produce a report. The report is 60 pages. It includes your genetics, your blood work across 11 categories, your sleep architecture, your hormone curves across seasons, your inflammation trends, your projected risk for the diseases your family carries. The report has a section called optimization, not treatment. Optimization, medicine at this level isn't about being sick. It's about delaying the things that haven't happened yet. The flu is handled by a nurse practitioner who comes to your office. The IV drip you didn't know you needed is set up in your home gym on a Thursday morning by a woman who used to work at Johns Hopkins. You don't see prices. You don't sign anything. The system invoices Marcus. Marcus invoices you. You wire the number. Nobody mentions it. At $10 million, you don't get sick the way poor people get sick. You don't even get sick the way most rich people get sick. You get caught. The system catches the disease 6 months before it would have shown up. The catch is so quiet you don't realize you were ever in danger. Level 8. $50 million. Your doctor's name doesn't appear in any directory. He doesn't take new patients. He hasn't taken a new patient in 7 years. You met him through someone who knew someone. The introduction took 4 months. He doesn't have an office in the traditional sense. He has a private practice that operates inside a hospital you've never heard of. You don't pay an annual retainer. You pay a relationship. The terms aren't public. The arrangement exists in a folder kept by an attorney. He's available within 30 minutes. Always. He flies to you when it matters. He flew to Aspen in January when you had a fever that wouldn't break. He flew to Italy in July when your daughter had an allergic reaction at a restaurant. The trips aren't billed. The trips are part of the arrangement. You don't navigate the medical system anymore. The medical system navigates around you. When you need surgery, the surgeon is briefed by your physician on a call the night before. The OR is held for your time slot. The recovery suite is the entire floor. No other patients. The room has the kind of view people pay for at hotels they remember forever. You don't feel grateful at this level. You felt grateful at $50,000. Gratitude at this altitude doesn't apply because access at this altitude isn't a gift. It's the air in the room. You ask him once how he justifies the time he gives you. He looks at you for a long moment. He says, "You're not paying me for the time. You're paying me to be the person who picks up the phone." Somewhere right now, someone is sitting in the ER waiting room at 11:47 p.m. on a Tuesday. The chair is plastic. Their ankle is the size of a softball. They have $312 in their checking account and no insurance card to hand the woman behind the glass. The doctor will see them at 2:38 a.m. He will look at the chart before he looks at them. He will say probably a sprain. The bill will arrive 6 weeks later for $3,140. They don't know yet that 8 levels above them, another doctor is flying to Italy at his own expense because someone he calls a client has a fever that won't break. Same training, same medical school, same human body. The medicine never changes at every level. The time does. The attention does. The phone calls answered on the second ring do. You are the same patient at every income. The doctor just decides who you are based on what's next to your name. The doctor doesn't change at every level. You change in the doctor's eyes. And the eyes are the whole game.